many AI in the mobile, a number of applications we are having using to so many tasks we are doing. So why it is helpful to us? Because there is a lot of explosion at the medical data information, time pressure on clinicians on various fronts, and quality bound from intimacy to excellence. So AI is the solution for the above problems. Remember, AI is the assistant, not replacement, not boss. If you remember, during residency, one of Mohan was our AI of that period. AI is smart software, second brain that understands text and images, learns from the data. So these are some of the examples of the past of the AI. Ganesh said transplantation is the best. AI was coined by Professor John McCarthy, and in orthopedics it began exploring AI's potential in imaging and diagnostic by early 2000. AI is brain, software, idea, imagination, tools, thinking, just like a human brain. Robotics is body, physical machines, it perform action tasks. So there are three varieties: artificial intelligence, machine learning, and deep learning is the latest, which is autonomous in action. Intelligent robots can see, learn, act independently, from navigating self-driving mode to complex performance tasks, just like we are doing hip and knee replacement surgery. We use daily so many AI platforms, tools for performance of the very task, and our performance becomes efficiently, accuracy, academic, clinical output, and reduce the burnout. Also significantly reduce the time spent on repetitive tasks while supporting decision making and continuous learning. One of my friend in USA is doing his OPD 600 miles from his home. He is running his clinic and visiting once in a month only. So he is operating through AI, remote clinics. How many functions we are performing? If you recount, there are hundreds and thousands of actions we are doing using AI, but we don't know that we have been using all these things for so many years. And in your future, it will replace no assistant, no salary, no professional tax. Staff and nurse can make mistakes, errors, and behavior pattern, but AI will not make these mistakes. Also, in number of diagnostic imaging laboratory tools, they have become precise. In seconds, you diagnose the things. Automatic grading of various diseases, even diagnosis of various diseases in the earliest stages, even in the fetal state, they can diagnose. And they have, in future, we will have technique to operate intrauterine defects of orthopedics. We can correct. Something has come up, so diagnostic accuracy and surgical planning can be done better with the AI. In OR also, AI has very important role in orthopedic procedures. It gives various checklists to avoid the human errors. It ranging from pre-operative planning, execution and rehearsal, training and education, assistance during surgery. AI-powered surgical robots are very useful, will be useful. Custom and smart implants are replacing gradually our practice, post-operative care and rehabilitation. We all know AI enhanced the surgical planning and robotics. Our replacement therapy has revolutionized like anything. Surgical precision, small incision, early recovery, less pain, and early return to ADL. And create the personalized surgical plan, implant durability and patient satisfaction. These are the advantages of the robotic surgeries. Even this is helpful in spinal surgeries. A number of implant devices and sensors reducing the complications, improve the outcome, safety and confidence is increased. The tools are rapidly evolving. Do not be afraid. Be cool, calm, courageous, conscious to cope up the community of AI. Even in 3D in cast technology also has revolutionized and fully customized orthopedic tailored to each patient for comfort and freedom. Application in minutes and removal in seconds, fully with waterproof, weatherproof and cleanable. But remember, AI is only mechanical thing. Human approach may not be forgotten. We should take care of this. Man has become machine. Human touch is lost. AI cannot show sympathy, emotion, bedside manner. AI has clinical judgment, skill, but forgotten that intuition that machine cannot replicate or generate. AI gives depersonalized care, so patient have increased anxiety, erosion of patient trust. Losing human touch, even de-skilling of the surgeons. If you are doing routinely close nailing and suppose one time you have to open it, then it is difficult, unexpected complication when the robot fails. So black box phenomena, Andalama Golibar, from where the result has come we don't know, but expandable open AI has come as a solution. Depersonalization, patient feel like data rather than feeling his pain and needs. Reducing the therapeutic alliance. Decrease in the person time, AI takes over diagnostic and administrative tasks. Direct eyeball contact and communication decreases. So robotic surgery is not a science fiction anymore. Robot offers everything superior, will outperform the surgery in the coming years, and we will sitting outside the operation theatre. Machines do not get tired, do not get off days, salaries, nor get stressed, distracted or shaky. And robotic surgery can give incredible precision, steady movements, accurate planning, few human errors. All definitely improve better and more outcomes. In reality, surgery is not a mechanical job as we think. It is not only cutting, stitching or removing and replacing something. Surgery is a judgment. It is what happens when things do not go as expected. Sudden bleeding, unusual anatomy, complications and decisions that need to be made in seconds by human but not by the robots. Inadequate registry or poor imaging quality can cause malalignment and wrong cuts deformity. If not done, can lead to disasters. So beyond all that, surgery is deeply human. Please do not come with only, patient do not come with only reports, but they came with the fear, stress, doubt. They want to feel safe with us, not with the machines. A robot can perform a perfect plan, but it cannot offer reassurance, empathy, or calming presence that helps a patient trust the process. Much of the healing begins with that trust. Machine can calculate angles perfect, but it cannot look at patient in the eye, give them the confidence when they are at their most vulnerable. The future of surgery should not be about robo replacing surgeon. It should be about robo enhancing precision while doctors continue to carry the responsibility, compassion, judgment, and human connection. Technology can upgrade our hands, but only humans can truly care for and heal the person physically, mentally, and psychologically. A number of impact of AI will be in the near future: academics, education, learning, teaching, and marketing at all levels. But patient being operated is the near future operated by AI. Patient is worried when doctor ક્યારે operation theatre માં આવશે. So patients, the robot says, don't worry. He says, doctor is not playing video game in the side room. He is operating me. So this is the future game of AI. There are limitations. Use of AI is neither universal nor perfect. High capital cost, long learning curve, agitation, fear of failure, agitation of learning, and time need to use both in preparation, intraoperative, machine app learning, variable reliability of AI technology and tools, absence of long-term follow-up studies, ethical, legal consideration, human touch to AI obsession, and evils of AI, which is a very long subject I will not discuss at present. This is very worst complication of AI. We all know before 2 months this has happened. These are golden rules of AI. I did not go into discussion, but AI is assistant. Again, I repeat, not authority. Surgeon is the final decision maker. A number of tools we have been using everywhere, in mobile, in computer, even in the operation theatre and robot, and so many tasks are being performed. So in future will be 3D implant, robotic assisted surgery, tele-robotic surgery, surgeon sitting in the next room or building or continent and operating on a patient with good surgical precision, decision, MIS, improved visualization, dexterity, AI-driven robot perform acute surgery without human intervention, just like driverless cars which have come already. So there are number of tools coming, microscope, loops, monitors. Even when you see specs, you will see inside of the body also. So that is the AI is not magic, but it is magic for surgeons' time, saving, sparing, place, thinking and communication. It's a second brain, checklist, reminders to reduce the errors, mental fatigue, give better output. AI is powerful supportive tool in orthopedics, improving imaging, diagnostic efficiency and enhance surgical dexterity, but cannot replace expertise, knowledge, clinical judgment, acumen of surgeon. The orthopedic surgeon must remain centered to the patient care even in operation theatre, even if robot is operating. AI will not replace us in orthopedics, but orthopedic surgeon with AI knowledge and experience will lead the future of orthopedics. Just our Dr.GJPurohit and Dr. Naveen Thakkar are the best examples of patient care education, professional growth, self-learning. AI is the future, be creator, not just user in OPD. Build and deploy real apps, present, publish, work online, conference and webinar. So adopt AI, learn AI, unlearn, relearn AI, hope for the best. Do not be machine mechanic, but remain human technology. Human technology should pull us closer to the patient, not away from them. So thank you very much. Before I conclude, one small story. After 20 years when AI is full-fledged, he is a resident in orthopedics, moving with a robotic human all the while. Recently got married, went to his mentor to get blessings and any advice. Mentor told that you do anything, but you don't bring this human robot with you. Otherwise, he will overcome you in the honeymoon and only video games. Thank you all.